Did you know that intermittent fasting could be affecting more than just your weight? Surprisingly, intermittent fasting can play a big role in your oral health. So in this video, I'm going to talk about how it affects a few specific things: your teeth, potentially any cavities, any gum disease, and also your breath. So intermittent fasting is also called time-restricted eating, where you basically restrict your eating window to very specific times. So sometimes people will do this every single day, and they'll do something called a 16-8 fast, where they fast for 16 hours and they only eat within an 8-hour time period. Sometimes people will do an alternate day fast, where one day they eat like normal, the second day they'll fast and they won't eat anything, and then every other day they'll fast just like this. Or sometimes people will even do a one-day fast, where they'll fast one day in a whole week, and then the rest of the week they eat just like normal. Basically, the goal here is to just cut calories and reduce the amount of food that you're eating. Whatever the reason that you are fasting, whatever style that you're doing, regardless, it's gonna have some benefits to your teeth that can actually prevent cavities. The biggest thing is you're gonna be snacking less. So when you snack less on food, you're gonna have less carbs entering your mouth. So you have this bacteria in your mouth called strep mutans, or Streptococcus mutans. This strep mutans bacteria will feast on carbohydrates that enter your mouth. In turn, they'll release lactic acid, which will cause cavities or holes to form in your teeth. The less frequently that you introduce carbohydrates into your mouth, that means the less chance that you get cavities. Normally when you eat something, you have a lot of saliva building up during that meal, and then if you give yourself a break between that meal and your next meal, then you're gonna give your saliva plenty of time to wash away any leftover sugars or carbohydrates, and also wash away any acids that might be building up, which could be causing cavities. But if someone were to frequently snack throughout the day, if they eat a meal and then they decide they wanna snack on chips, and then they eat their next meal, and again they're gonna snack on crackers or something like that, then they're not really gonna give that saliva time to build up and then wash away the leftover food particles and any acids building up. And they're also going to be constantly introducing these sugars into their mouth, which means that these strep mutans bacteria are going to have a field day, and they're going to keep releasing lactic acid on your teeth. This is how people can develop lots of cavities. But people who practice fasting, they're limiting the opportunity for these bacteria to feast on these carbohydrates and then cause cavities. Now, just like how it can prevent cavities, intermittent fasting can also improve the health of your gums. And it does this by reducing the inflammation throughout your body and in your mouth. So this study was published in the Journal of Periodontology, and they were looking at the effects of long-term fasting on periodontal health and also on subgingival microbiota, or in other words, bacteria that live underneath the gums. And periodontal health is essentially the health of your gums and also the support structures of your teeth. So the bones around your teeth and also the attachment of your teeth to your gums. The type of fasting they were doing in this study was a 5-2 diet, where 5 days out of the week they're eating like normal, and then 2 days in a row throughout the week they're eating a quarter of the amount that they normally eat. So they're not completely fasting on those days, but they're eating a quarter of their normal calorie intake. And they were doing this for 6 days, and they found that things like their weight, their BMI, C-reactive protein, HbA1c, their cholesterol profile, all improved significantly. Now the thing is that all of these things can be improved alone with simply cutting calories. So I'm not too impressed by this part, but what I did found interesting is significant reductions in bleeding upon probing. Now, probing isn't like that alien abduction type of probing. I'm talking about when you go to your dentist and they start measuring your gums and they start shouting out numbers like 3, 2, 3, or 4, or something like that. They're measuring the sulcus, or the pockets around your teeth. And bleeding upon probing is something we check for, where when we're measuring the sulcus, we see if there's any bleeding around your gums. This is where a lot of those memes come from, where they say that your dentist blames you when they're poking you with these sharp instruments because it's your fault that you're bleeding. And it's funny because it's kind of true. If you do not brush and floss regularly and you have a lot of inflammation in your gums, then your gums are going to bleed a heck of a lot more. Healthy gums should not be bleeding even when they're being probed properly. And bleeding on probing is one of the best indicators we have for gum inflammation or gum disease. So if bleeding on probing is going down, or there's much less bleeding in people's gums, that means that people's gums are getting a whole lot healthier. The other thing that they found that I thought was really interesting was shallower pockets. So there wasn't any changes in their plaque index, like how much plaque they were building up or bacteria on their teeth, and there wasn't much change in their actual microbiota. So the diversity of the bacteria that lived in their gums was the same. But a majority of the people that were fasting had significant reductions in their pocket depth. So that means that the depth of the sulcus, or how deep these pockets are, got shallower. And that's a good sign. When you have shallower pockets around your teeth, then that means that your gums, again, are healthier. But when you get deeper pockets, like when they start shouting numbers like 4, 5, 6 or higher, that means that you have some active gum disease going on. And most people's pockets reduced by over 60%. Now this is huge, because when people have deeper pockets and they have this active gum disease, then typically what they need is something called scaling and root planing, or a deep cleaning. Now a deep cleaning is done where you essentially clean underneath the gums. You clean any plaque and tartar and bacteria underneath the gums to reduce that inflammation. Because what happens is if this isn't done and this continues, then these bacteria will stay underneath the gums, keep this gum disease going, and then they'll eventually eat away the bone around the teeth, and then eat away this attachment around the teeth, and the teeth will eventually get looser and looser, and eventually they could fall out. This is the most common reason that people end up in dentures, because of gum disease that's gotten very extensive. So for people to have a 60% improvement in their probing depth numbers in just 6 months, this is great. Because when we do a deep cleaning and we bring patients back to check the success of that, the two major things we're checking are the gums if they're bleeding, we're checking for any inflammation otherwise, and we're also checking the pocket depths. If we see any improvement in the pocket depths, we are happy. But if we see a 60% improvement, we are ecstatic. Their primary finding that I quote from the study suggests that clinical markers of periodontal inflammation and of systemic inflammation and metabolic biomarkers of insulin sensitivity improved significantly after 6 months of intermittent fasting. Essentially, I think this is a great representation of intermittent fasting will help you get healthier simply because you're cutting calories, and how much of a role just simply getting healthier does to the rest of your body, including your mouth. So was it the fasting and the less bacteria in your mouth that was causing this gingival inflammation to get so much better and people's gums to get so much healthier? Or was it the fact that they're just getting healthier in general? I think it's probably a bit of both, but regardless, I think this is some great news. If you do practice intermittent fasting, or you're thinking of practicing intermittent fasting, you get this added bonus. Now I want to go a little bit over the potential downsides of intermittent fasting. The main one when it comes to your mouth is you could have some bad breath. So you might think that you're eating less, you're getting less bacteria in your mouth, that your breath should be great, right? Well, when you do fast, especially for longer periods of time, your body might enter ketosis. This is essentially where your body stops burning carbs and starts burning fat as a source of energy. While ketosis can be great and have a lot of health benefits in helping you lose weight, it could also have a side effect known as keto breath. This is essentially because when fat is broken down, it'll produce ketone bodies. One of these is acetone. Now this acetone is released in your breath, and believe me, it does not smell good. It has a really metallic and kind of like a foul odor. The other reason you might have bad breath is because you might have a dry mouth. When you're fasting and you're not eating as much, you don't produce as much saliva, because your saliva is mainly produced and activated when you start chewing something. So if you're not really eating that often, your mouth could be really dry, and this could make your breath smell really bad too, because saliva is really important for fighting bad breath. In terms of your saliva, two really simple things you can start doing are, one, making sure you're drinking enough water to make sure you stay hydrated, but also start chewing gum. You could chew gum in between your meals, which will still stimulate saliva in your mouth and help keep your breath smelling good, also because of the minty flavor of the gum that you're chewing. And you still don't have to really break your fast. Some people might say that chewing gum breaks your fast, but I really don't think so. Other things to keep in mind are simply just practicing good oral hygiene, so make sure you're brushing and flossing regularly. Even if you're eating less, you could still get cavities, so make sure you're taking care of your mouth. I'd also make sure you're getting all the required nutrients, so things like vitamin C, vitamin D are still really important to maintain the health of your teeth and your gums. So when you're eating less quantities of food, you've got to be a little bit more careful making sure you're getting all your nutrients. And I would also avoid alcohol mouthwashes, because alcohol can dry out your tissues and make your dry mouth even worse. So if you're used to using a mouthwash or something like that, make sure it doesn't have any alcohol in it. So that's all I have for you guys. I hope you liked that video. Hope you learned a little bit about intermittent fasting. And if you do practice it and you want to share any stories, please let me know in the comment section below. As always, if you haven't already, hit that thumbs up button and subscribe to my channel below, and I will see you guys in the next video. Some people simply avoid going to the doctor or avoid going to the dentist because they think either it's a waste of money or it's a scam or they don't have enough time, or they think that they don't really need to go because they already take pretty good care of their mouth or their health. Now, if this sounds like you when it comes to going to the dentist, you might be okay, especially if you do take care of your teeth.